So, welcome to chapter 7, and we've moved on from our anxiety disorders now to stress related, dissociative, and somatic symptom disorders. So, this is where we're going to get into discussing trauma. And in module 1, what we're going to focus on most specifically is acute stress disorder and post traumatic stress disorder. So, acute stress disorder is commonly known by the acronym ASD, and post traumatic stress disorder is well known, probably even more so for its acronym of PTSD. And of course, we've heard about PTSD in a range of incidents from traumatic experiences like being at war to things like domestic violence. So we'll cover kind of the whole gamut here in this particular chapter. And module 1 and the first couple of modules are specifically focusing on the acute stress disorder and post-traumatic stress disorder. And then we'll move on into some dissociative disorders and somatic symptom disorders. So this is where the more severe psychopathology comes into play. We certainly, not to minimize mood disorders and anxiety disorders, which we spent the last couple of chapters discussing, but now we're getting into the more severe end of psychopathology and will be for the next few chapters. So let's go ahead and talk a little bit about what we mean here. So, traumatic stress. Now, the DSM 5 goes ahead and defines the traumatic stress as an event that's going to involve actual or threatened death, serious injury, or sexual violence to yourself, witnessing others who experience trauma, even learning that loved ones have been traumatized, or repeatedly being exposed to the details of trauma. So, as you might be able to tell here, there is a very wide definition of what traumatic stress is. One of the reasons that there is such a wide definition is that it impacts individuals differently. Sometimes it can be a vicarious experience, like just hearing about loved ones' traumatized experience or watching it on TV. Other times, people have to experience that trauma more directly for things like PTSD to develop. But whatever it is significant and it has a profound impact on individuals. Now, going along with that, and what we'll be talking about is that goes as part, it almost runs through a lot of these disorders, is dissociation. And that's the disruption of normally integrated mental processes involved in memory, consciousness, identity, or perception. And we're going to see various ways that dissociation comes into play for these particular mental health disorders. Okay, so let's first focus on ASD and PTSD. And so, post traumatic stress disorder, PTSD, it's going to be defined by symptoms of re experiencing the traumatic event, having avoidance, having increased autonomic arousal, and or anxiety. So the increased autonomic arousal, that is the sweating, the heart beating quickly, the hypervigilance, all of that usually occurs. And all these symptoms have to occur for more than a month. So now we're getting into the stage in the book where we're talking about disorders where it's one disorder if it lasts for this length of time, and it's another disorder if it lasts longer that length of time. And so for post traumatic or PTSD, you have to have all of these symptoms that we're discussing for more than a month. And then the difference with that and acute stress disorder is the acute stress disorder is the first 4 weeks after you've been exposed to the trauma. And it has pretty much the same symptomology as PTSD and other dissociative symptoms, other than it is usually occurring just in that first month or so and not afterwards. After that, if it persists, it's going to go ahead and be considered PTSD. Okay. So, what are some of the symptoms? And we already talked a little bit about that just in the definition of PTSD, but let's look a little bit more detail here. And so, the first thing is experiencing or re experiencing the trauma. So, these symptoms often follow the trauma, where some people experience kind of repeated distressing memories of the incident, and others might relive it through horrifying dreams. So, they may be very reluctant to try to go to sleep again. You can see these kind of nightmares and distressing images. Sometimes it occurs through flashbacks. Flashbacks are these sudden memories during which the trauma is replayed in images or thoughts at the full emotional intensity. So there's something about the way that we process memories in a typical way that we tend to strip a lot of the emotion away from those memories. So just think about a birthday party that was a really good birthday party. You had a lot of fun, really enjoyed things. And now think about it. And yeah, you remember that you enjoyed it, but you're not re-experiencing the emotions, that enjoyment at the full intensity that you did in the moment. And that's because when we have memory, it will strip away a little bit of the emotion as it stores it. And then the other thing that happens is every time we bring up a memory, as we're finding out, we're melding it with our current state. So if I'm sitting here in my room and I'm remembering a birthday, but the room here is pretty neutral, nobody else is around, I'm not going to recall or blend that memory with the same intensity. That is not the case with flashbacks. Flashbacks is like you are reliving it all over again at its full intensity that you had. And as you might imagine, with it being trauma, these are very unwanted, intense emotions versus things like happiness and joy, which I would say a lot of people wouldn't mind re experiencing. Okay, so those are flashbacks. And then you have dissociative states, and this is the most extreme form, and this can involve a person feeling and acting as if the trauma actually were reoccurring in the moment. So it's more severe in as far as magnitude compared to flashbacks. Flashbacks, you still have the emotional, but you still, you realize that it's not now happening. In dissociative states, you do not realize that anymore. You are back in that instant, like somebody transported you back in time. And you can imagine how scary that might be if you're undergoing that. Now, with avoidance, this is going to be a persistent avoidance of stimuli that are associated with the trauma. So, we just talked about phobias. So, in some ways, think about phobias. The phobias develop because people develop some sort of negative association with something in an effort to avoid that feeling again or that anxiety, they avoid it altogether. Same thing's going on here with PTSD, but a little bit different oriented. So a lot of times thoughts or feelings related to the event or locations, all of those may result in the avoidance, and that is one of those symptoms. Okay, next, some other symptoms is the arousal or anxiety. So people may be feeling restless, and so they just feel like they, are always fiddling with something, feel like there's pent up energy. They may have agitation, so they may be short with others, irritable, agitation, irritable. They could have an exaggerated startled response. So it's almost like they are on edge. That's probably really the best way of thinking about this kind of arousal or anxiety. They're on edge, and it really doesn't take much, kind of a hair trigger, to set them off. And it's impossible for them to ratchet that down, this almost hypervigilance that's going on. And so that can involve also sleeplessness and or insomnia, because they just cannot let their guard down. They are just constantly keyed and ready for action, whatever that may be. Some other symptoms, negative mood or thoughts. So, what you begin to see is just the inability to experience positive emotions at all. Instead, it's replaced by this persistent fear or anger, maybe some guilt or feelings of detachment from others. And sometimes they refer to this as an emotional anesthesia, where it's just a general numbing of any responsiveness at all. They are just numb. And so nothing in the outside environment seems to impact them because they've kind of escaped away from it all. And then you also have dissociative symptoms that can show up in ASD and PTSD. So there's these like feeling dazed, they're out of touch with reality, and they're not experiencing or integrating their experiences or a set of experiences. So this can result in the feeling of depersonalization, that they are cut off from themselves or their environment, like they're apart from it. The derealization, sensing that this is just unreality in the world, like it doesn't seem like it's really real. Okay. And then you have dissociative amnesia, which is the inability to recall important aspects of the traumatic experience because the trauma has been so significant, almost part of a inbred coping mechanism. It's just even cut off aspects of it, and not even acknowledge it happening because it was so traumatic, and the implications of remembering are just so damaging. So, as you can see, quite a bit of symptoms of ASD and PTSD when you see this. So, how do we go about diagnosing? Well, and to answer that, we're going to go into Module 2. So, stay tuned for that.